This passage is quite an easy passage. It reads very easily. It's easy to read. It's about the American healthcare system. Let's quickly read it and summarize it. The America's individualistic bent has also shaped its entire healthcare system, which ties health to wealth and employment. That system is organized around treating sick people at great and wasteful expenditure. The latter is the remit of public health rather than medicine and has been long underfunded and undervalued. Even the CDC, the nation's top public health agency, changed its guideline in February to prioritize hospitalizations over cases, implicitly tolerating infections as long as hospitals are stable. First paragraph, what does he say? That America has an individualistic bent. It tends to be very individualistic. And this individualistic trait has shaped its healthcare industry. Its healthcare industry caters to wealth and employment. It's connected to wealth and employment. You have money, you get healthcare. You have a job, you get some healthcare facilities tied to your job, right? Health insurance is tied to your job. That system is organized around treating sick people. So when they treat, the treatment given in America, according to the author, is great and wasteful. A great and wasteful expenditure. The treatment that they give to patients, according to the author, is a wasteful expense. Why? Because it can instead prevent communities from falling sick in the first place. It is giving treatment rather than focusing on prevention. The latter, prevention of disease, is the purview, is under the purview, is under the uh, is in the area of public health. So, public health is concerned with uh, preventing infections, and that's not the doesn't come under medicine. It has long been underfunded and undervalued. That means Americans don't believe in preventing diseases. They do not believe in public health. They do not value or fund public health enterprises, which involves prevention of diseases. Even the nation's top public health agency changed its policy. So, what was its policy? It was prioritizing hospitalization over cases. So, it was tolerating infections as long as hospitals are stable. But such a strategy practically ensures that emergency rooms will be overwhelmed by a fast spreading virus. What happened during Corona? Right? If you have that strategy that hospitalizations are more important, treatment is more important than prevention, than community health, then your hospitals and emergency rooms will be overcrowded when there is a fast spreading virus. That consequently, healthcare workers will quit. When you have so much work, when you have so many patients, there'll be a point when your healthcare workers will quit. We can't handle it. And that waves of chronically ill long haulers who are disabled by their infection will seek care and receive nothing. People who have long term illnesses will seek care and get nothing in the process. All of that has happened and will happen again. He's saying this has happened in America. We've seen this. That's how he's saying all this will happen. It has happened before and it's going to happen again. America's pandemic individualism, even during the pandemic, it followed individualism. Therefore, he calls it the pandemic, it followed individualism. Means that what is America's pandemic policy, pandemic individualism? Your job to protect yourself from infection. If you get sick, your treatment may be unaffordable, but if you don't get better, you'll struggle to find help and or even anyone who believes you. Basically, you're telling the patient you're on your own. You have to protect yourself from illness. If you get sick, your treatment may be unaffordable. If you get sick, you can come to the hospital, but the hospital is very expensive, so you may not be able to afford treatment. If you don't get better, you'll struggle to find help. You can't get any help because we cannot do it. Unless you pay money, you will not be treated. And that's the problem. In the late 19th century, many scholars realized that epidemics were social problems. Epidemic is not an individual thing, it's a social thing. It affects the entire society, whose spread and toll are influenced by poverty, So why do epidemics spread? Why do people die in epidemics? Toll, the number of people who die, the toll of an epidemic. Poverty, inequality, overcrowding, hazardous working conditions, poor sanitation, political negligence. All these are causes of pandemics. But after the advent of germ theory, this social model was displaced. So earlier there was the social model. The pandemics happened due to society. Pandemics happened due to inequality, poverty, overcrowding, and all these reasons. So there was a social aspect given to uh, illnesses like pandemics. But once the germ theory took over, this social theory was neglected. It was displaced by a biomedical and militaristic one. So the approach, the germ theory's approach, was biomedical and militaristic, in which diseases, so why is he calling it militaristic? Diseases were simple battles between hosts and pathogens playing out within individual bodies. So what disease is nothing but a fight between hosts, which are pathogens which are in your body, and the pathogens which attack your body, playing out within the individual bodies. This paradigm, saying that diseases are nothing but battle between hosts and pathogens, conveniently allowed people to ignore the social context. So the social context was conveniently ignored. Instead of tackling intractable social problems which are not easily solved, scientists focus on fighting microscopic enemies with drugs, vaccines, and other products of scientific research. So they started looking at prevention of diseases due to viruses, bacteria, microscopic enemies with drugs, vaccines, and other products of scientific research. An approach that sat easily with America's abiding fiction on technology as a panacea. Americans believe that technology can fix and cure everything. So, this scientific way of fighting with microscopic enemies like the bacteria and virus through vaccinations and medicines went well with the Americans because it was using technology and science to fight diseases. So the social part was removed, was ignored. The allure, the attraction of biomedical panaceas is still strong. This belief in biomedical treatment or cure is still very strong. For more than a year, the Biden administration and its advisors have reassured Americans that with vaccines and antivirals, we have the tools to control the pandemic. Even now, America says we have the tools to control the pandemic. And what are those tools? Vaccines, antiviral medicines. These tools are indeed effective. The author is not saying that they're not effective. He says they are effective, but their efficacy, their effectiveness is limited. Why? If people can't access them or don't want to. So you can only use vaccines and antivirals if people can access them. Antiviral medicines and vaccines can only be useful if people can access them. Only then their infections will be cured. So they are inaccessible. In the second case, some people don't want it. You have a lot of people who are anti-vax people, they say. The anti-vaxxers, they don't want vaccination, right? And if the government doesn't create policies that shift that dynamic, so the government policies also are such, it should shift that dynamic. It should make these remedies of vaccines and antivirals accessible to all. But the government doesn't shift its policies, then this will be the continuing state. A profoundly unequal society was always going to struggle with access. America is a profoundly unequal society, and so there is a problem of access. Who gets access? The rich. Who do not get access? People with low incomes, food insecurity, eviction risk, and no health insurance struggle to make or attend vaccine appointments even after shots were widely available. You had vaccines, American hospitals had vaccines, but people with all these problems, they don't have money, they don't have food security, they have the risk of being evicted from their house, they have no health insurance, so they could not even use the vaccines which were readily available. They couldn't take them. All right. A profoundly mistrustful society was always going to struggle with hesitancy, made worse by political polarization and rampantly spreading misinformation. That is one side, not being able to access vaccines. Second side, America is a profoundly mistrustful society, and it was struggling as with hesitancy. Their hesitancy of whether we should take vaccines, what should be done, was compounded, what made worse by political polarization. What happened in America is people were identified. People's political leanings could be identified by whether they took a vaccine or didn't. So there was one party, the Republican Party, was predominantly anti-vaccine. They were even anti-masks. They said we have a right to not take vaccines, right to not wear masks, freedom. On the other side, the Democrats wanted it. So the country was polarized on the question of vaccines and masks. So he said, made worse by political polarization and rampantly spreading misinformation. Anybody could spread misinformation. Vaccines are not working. So many people died with vaccines, whatever. The result is that because of all this, there was just 72% of Americans have completed their initial course of shots, and just half have gotten over the first booster necessary to protect against current variants. Only 72 have got their first shot, and only half of that have taken the boosters. At the same time, almost all other protections have been stripped away and COVID funding is evaporating. On one side, you're not taking vaccines, on the other, you're losing other forms of protection, COVID funding and any other kind of protection. And yet, the White House's recent pandemic preparedness strategy still focuses heavily on biomedical magic bullets, paying scant attention to the social conditions that could turn those bullets into deaths. They're ignoring social conditions. These social conditions would make those, what does he call, biomedical bullets, vaccines, antivirals, all that, they could become ineffective. You do not treat the social conditions. Technological solutions also tend to rise in society's penthouses while epidemics seep into its cracks. So you have technological solutions on one side in the society's penthouses, means in the top layer, the economically well off, the top tier of society, you have new technological solutions. But what happens? There are also cracks in your society through which epidemics seep in. Cures, vaccines, and diagnostics first go to people with power, wealth, and education. These technological solutions to anything, to disease, to pandemics, to viruses, uh, cures, vaccines, diagnosis first reach whom? People who have the money, people who have the education, who then move on. So they are prepared, they are protected, leaving the communities most affected by the diseases. Who are the communities most affected by the diseases? The poor, the illiterate, the people who don't have all these benefits, continue shouldering their burden of disease due to bad social conditions. This is the author's passage. Which of the following statements best captures the main argument of the last paragraph of the passage? So we need to go back to the last paragraph. Before that, we'll quickly look at the options and eliminate any obviously wrong ones. Epidemics continue long term because healthcare and medicines are not subsidized by the state. Has that been said in the last paragraph? Effective medical treatments are only for the rich. We know this is not correct. And this he has, right, only for the rich. When it comes to epidemics, the not so well off people requiring medication for illnesses cannot afford them. He has talked about this somewhere in the passage. Whether it's in the last paragraph, we have to confirm. Rich people tend to migrate out of their locations after getting expensive treatment. He said they tend to move on, doesn't mean migrate, right? So again, that is not an answer. So this and this are obviously wrong answers. Let's look at the last paragraph. This is the last paragraph. Technological solutions also tend to rise into society's penthouses. Technological solutions are available in society's penthouses, in the top hierarchy, in the top, the cream of society, while epidemics seep into its cracks. The cracks which are there in the society, the divisions of society, is where epidemics come in. Cures, vaccinations, and diagnostics first go to the people with power, wealth, and education. Yes, you have technological solution, they go to people with wealth, power, and education, who then move on. Oh, cured, right? Doesn't move on, doesn't mean migrate. Okay, leaving the communities most affected by the disease to continue shouldering their burden. So the rich, the wealthy, the powerful get away with getting the best cures. Those who not, the poorer communities who don't have money, power, or education are left. They are affected by the disease and shoulder the burden of the disease. This is what he says in the last paragraph. Which of the options is closest to that? When it comes to epidemics, the not so well off people requiring medication for illness cannot afford them. A has not A does not talk about subsidizing. Last paragraph doesn't talk about subsidizing by the state. Effective medical treatments are only for the rich. He talks about the powerful and the educated also. So only for the rich doesn't happen. So answer is C.